If you suffer from back pain, no doubt you spend a lot of your time trying to figure out what you can possibly do to remedy that problem. And I'm sure, like so many of us, the idea of surgery is the last thing you want to consider. So lucky for you this morning, we have a chance to speak with Dr. Shay Richardson from the Center for Sports Medicine, who has his own non-surgical idea that could be a benefit to a lot of people, talking spinal ablations this morning. Good to see you, Dr. Richardson.
Good to see you. Thanks for having me.
So what is a spinal ablation exactly? Because it is non-surgical, right?
Correct. So it's at its root, it's a minimally invasive procedure that allows us to use heat to cut some of the nerves that are causing pain and that cut the traversing pathway from those areas to the spinal canal.
When you talk about the nerve pain that exists, is this a fair assessment that so often in anything orthopedic, where the problem feels, where you feel the pain, might not necessarily be where the problem generates?
That's accurate. That's very insightful. As a matter of fact, I have a lot of patients who come in and who will tell me they're having muscle pain. But unfortunately, a lot of times the root of the problem is much deeper and oftentimes is affecting certain areas of the spine.
So, a lot of us, probably most of us at some point in our lives are going to have some version of back pain, and whenever it comes your way, you want to get rid of it quickly. When it comes to the spinal ablation conversation, is that back pain typically chronic, or does it tend to be more of an acute problem?
So, you're correct. Usually 80 to 90% of the population can be affected by low back pain. And then there's also a high percentage as well with neck pain. Unfortunately, some of the studies indicate that up to 70% of folks who have low back pain, it can go on to be more chronic in nature, meaning greater than 3 months in duration. And so the spinal ablations are geared more for patients whose pain has become more chronic in nature and have failed many of the other conservative modalities such as physical therapy, medicines, etc.
Okay, so let's go back with the idea that you're a candidate for this spinal ablation. Does it matter where in your back the pain exists, and is it relegated only to your back? What if your pain is in your shoulder or something?
Yeah, so the majority of the ablations that we do are spinal related, and most of them involve joints that are called facet joints. And these are joints at each level of the spine on each side. And just like a knee or a shoulder, they're true joints that can become arthritic and painful. But you are correct in that we can also do ablations, depending on the patient and the pathology that is present, in the peripheral areas such as the knees and sometimes in the shoulders as well.
I know we have a chance to talk with many on the physicians there at Center for Sports Medicine on kind of a rotating basis, and kind of a common theme that seems to happen is talking about new advancements in technology that y'all are bringing in to the practice. I know y'all are doing something called Intracept, is that right?
Yes, so this is a newer procedure that I'm really excited about, and it's pretty new in its FDA approval. And so typically when we talk about ablations, and we're talking about the spine, there's the posterior portions of the spine, and those facet joints that I alluded to earlier. But then also in the front of the spine, where your discs and where your bones, your vertebrae are located, they also are pain generators. Unfortunately, a lot of times for this particular type of pain, really the only thing beyond physical therapy and medicines, injections don't really tend to work well for that. So the only one of the big options that we had for that previously was surgical fusion, and that can lead to further problems, unfortunately. So with this Intracept procedure, it's actually an ablation of a particular nerve called the basivertebral nerve that runs inside the vertebrae. And what we found is the bones connect to cartilage just before they meet the disc, and it's those cartilage end plates that can become inflamed and painful. And so this is a really new, exciting procedure that I've done a few of and just had excellent results. And so we really feel like this is going to be a nice bridge for patients as we move forward.
Sometimes when you have these newer technologies, they're considered they're not always covered by insurance. In this case, is this one insurance covered?
Yeah, so great question. So currently it's covered by Medicare and Medicare replacement, but we do have a cash pay option here at CSMO where we can offer to folks who are not covered by those particular entities. So our hope is that within the next year or two, hopefully it will be covered by commercial insurances, but currently is not, but we do have a cash pay option here.
Okay, and before I let you run, I know nothing is a one-size-fits-all anymore, but I've heard it said on this show many times from doctors that sitting is the new smoking. We sit a lot as a country. Is that sedentary lifestyle, does that take its toll on our backs?
It does, and I wouldn't say, for me at least, I wouldn't say that I hate to put the crosshairs on sitting as the primary culprit, but I think that you're very insightful when you talked about sedentary activity, and more than sitting, I think it's a lack of movement, lack of exercise, lack of core strength, and so that's where we kind of fall back to basic exercise prescription, where we really want our patients to try and engage in about 150 minutes per week of light to moderate exercise activity. And that's been shown to have benefits directly on painful states through multiple pathophysiological mechanisms, but also benefits the mental, the emotional, the other aspects that are involved in chronic pain states.
Very true. Dr. Richardson, thank you so much for your time this morning. Let me show our audience how they can get in touch with you there at Center for Sports Medicine. The phone number is 624-2696. Sportmed.com is the website. If you call them, make an appointment, mention that you want to see Dr. Shay Richardson and find out about these potential non-surgical options for your chronic pain. Thank you again.
Thanks for having me. Appreciate it.